Have you ever felt pain or discomfort but can't figure out why? Well, the experts at Boulder Center for Orthopedics and Spine can help you. Their team has been dedicated to providing expert care since 1968 to help pinpoint where your discomfort actually comes from. Here to tell us more is Dr. Eric Schryver. Welcome in, Doc.
Thank you. Thanks for having
coming
me.
in.
Yeah.
We've had a good discussion so far. I'm really into athletic sports, gymnastics, all this type of stuff. And so tell me why you got into this.
Yeah, so really orthopedics in general, what I love about it is it's restoring function. So we're getting people maybe that can't maximize their lifestyle because they're uncomfortable, and that's really sports medicine, but orthopedics in general is getting people back to function. I've always sort of had a special place for sports medicine. I grew up a gymnast, started at the age of 4, that kind of classic story. I got in it and loved it and stuck with it, went all the way through college. So I feel like that's something that I can really use to relate to patients. I've had 3 surgeries myself, so I can understand how intimidating it can be from injury to surgery to the recovery. That whole process is really overwhelming. So having gone through that myself, I feel like I can really relate to the patients.
Yeah, that's a very personal story, and your passion obviously shines through in what you do. So that brought you to the Boulder Center, right?
Absolutely.
For orthopedics and spine. And tell me about some of the procedures and the way that your philosophy, the way you do things, minimally invasive, that kind of stuff.
Yeah, absolutely. So sports medicine, really, the bread and butter is arthroscopy. So basically what that means is we use a little camera to do big procedures. So we have a couple of poke holes that we can use to do everything, which is really awesome because you're less traumatic to all the soft tissue around the muscles and everything else. So
does that mean a faster recovery potentially?
Usually, yeah. So there are granted some surgeries that still you have to do a big approach, and that's just the way it is. We haven't had technology that's allowed us to get to the minimally invasive. But in the opportunity that you have to do a minimally invasive procedure, less traumatic to everything else, usually means faster recovery.
Mm-hmm. So when someone comes in, I mean, you put them through the whole procedure. I mean, you diagnose, you do imaging, you do all of the steps right under one roof.
Absolutely.
And then you have to make a decision. How do you know deciding between if it's surgery or non-surgery for the patient?
Yeah, so I usually start with a really broad discussion with the patient. And the big question is, what are your goals? Because somebody that has a problem, it might be surgical for patient A, but for patient B, hey, they have different goals, their lifestyle is different, maybe we can try something conservative, and that's a really great option for some people. So when you have a problem that we've diagnosed, we know what's going on, I kind of give the whole spectrum of options. We can start by doing nothing. Most people don't really like that option because they're in my office to get some sort of advice, but nothing's always an option. We can do things like injections, physical therapy, bracing, and we really try to maximize those conservative options first because surgery is no small feat. You know, there's a lot of risk. It's inherently risky. We have really great procedures with predictable, reliable outcomes, but people need to understand we don't just jump to that. And a lot of people come in thinking, hey, this is an easy fix. We'll just do surgery and fix it. But that's not always the case. And there's a long road of recovery after most surgeries, too.
And do you specialize in any joint, like knees, hips? Is it anything?
I do a little bit of everything.
Yeah.
So my training is really broad, from my residency to my fellowship, which was specifically in sports medicine. So that's where my heart lies, is with the sports medicine procedures. But I do shoulders, knees, hips, elbows, you name it. I like to take it on.
And Colorado's like ground zero. I mean, you've got so many athletes here.
Absolutely.
I mean, just world champions around.
And usually that makes my job a little harder, actually, because they want to get back so fast.
I'm sure they do.
They're like,
it's their life.
Okay, you fixed me. I got to get back. I'm like, hey, let's pump the brakes a little bit, and we'll get you to where you want to be, but we need to go a little slower.
Why did you choose to join the Boulder Center?
Yeah, so we talked about it a little bit before as to why Colorado in general.
Yeah.
I'm not from here. I'm probably public enemy number 1. I'm from Texas, and I moved here from California, so probably a lot of people don't love to hear that. But Colorado's always been somewhere that I really wanted to live. I really love Colorado. I told you when I was a little kid in elementary school, they had one of those, where do you see yourself in 25 years? And even in elementary school, I said, I'm going to be an orthopedic surgeon, I'm going to live in Colorado, and I'm going to learn how to fix a broken leg in 3 days. Now we do it under 3 hours. So it's
Isn't that
kind
amazing?
of, it's kind of cool that I've had that transformation. But my wife and I really sort of narrowed down, what locations do we want to live? And Colorado, it just kept coming back and kept coming back. And then I met the folks at Boulder Center, and I have not had a bad interaction with a single person there, from the front desk staff to the janitorial staff to my fellow physicians, everyone's been so great. And they have other sports medicine physicians, which is something I really looked for because we have a real good team dynamic, a team approach. If there's a patient I see that I'm like, oh man, I'm not really sure how I should handle this, I have several other docs to do the very similar stuff to me that can say, hey, this is what I would do, this is what I recommend. And we have a really good collegial environment where we can kind of talk through things together.
Yeah, I like that. Well, Eric, thanks for helping people.
Yeah, absolutely.
Really
Love it.
Thanks for coming in here today. Here's a little more information. If you have any pain or discomfort in your body, there's a specialist at Boulder Center for Orthopedics and Spine that can definitely help you. For more information, you can visit their website, bouldercenter.com, or give them a call at 303-449-2730. And thank you to Boulder Center for Orthopedics and Spine for sponsoring this segment.